Welcome to a deep dive into a world that most people don't think too much about, end-stage renal disease. We usually call it ESRD.
Yeah, ESRD. And you've done your homework, so we're here to dig into the research with you and help make sense of all the medical stuff.
Exactly. We'll cut through all that jargon
Hmm.
and pull at the key insights and get to what really matters.
Yeah.
We all know kidneys filter our blood, but how much do they really affect our overall health?
Well, they do a lot more than just filter. They're like master regulators, constantly fine-tuning your internal environment,
Oh, wow.
keeping your electrolytes balanced, making sure your blood pressure is right.
Mm.
They even stimulate red blood cell production.
So they're not just like a
Way.
cleaning crew.
They're way more sophisticated than that.
Okay, so ESRD. What exactly happens when these
Yeah.
master regulators start to fail?
Well, ESRD is the last stage of chronic kidney disease.
Yeah.
It means your kidneys are only working at about 10% or less. So they can't filter waste and toxins from your blood effectively anymore. And that can lead to a whole bunch of issues throughout your body.
That sounds pretty serious.
It is.
I know diabetes and high blood pressure are big risk factors,
Yeah.
but I'm curious about some of the less obvious culprits. What else can cause ESRD?
So you're right. Diabetes and hypertension are the main culprits behind most cases.
Right.
But there are other things that can contribute, like chronic glomerulonephritis,
Okay.
which is basically inflammation of those tiny filters in your kidneys.
So those tiny little filters are getting inflamed. What causes that?
Lots of things. Infections,
Yeah.
autoimmune diseases, sometimes even certain medications can trigger it.
Wow.
And then you have things like polycystic kidney disease. That's a genetic condition
Okay.
where cysts form in your kidneys. And those cysts slowly crowd out healthy tissue.
It's like a slow takeover from the inside.
Exactly. And of course, there are autoimmune diseases like lupus, where your body basically attacks itself, including the kidneys.
It's amazing how many things can impact these vital organs.
They're really important.
What about early warning signs? How would somebody even know if their kidneys were in trouble?
That's the tricky part. The early symptoms are often really subtle and easy to just dismiss, like feeling tired all the time, even after you've had a good night's sleep, or swelling in your legs, ankles, or even your face. It's a sign that your kidneys aren't removing excess fluids like they should be.
So like puffy eyes could be more than just a lack of sleep.
Right. Exactly.
What else should we be looking out for?
Shortness of breath can be a red flag, too. It could mean there's fluid building up in your lungs, or it could be a sign of anemia, which is related to kidney failure. You might also notice nausea, changes in your appetite, or even brain fog.
Brain fog. I wouldn't think of that with kidneys.
It sounds strange, but when toxins build up in your blood, it can actually affect how your brain functions. So you might have trouble concentrating, feel confused, or even experience memory problems.
Okay, so say somebody is noticing some of these symptoms. What's the next step?
The most important thing is to see a doctor right away.
Yeah?
They'll run some tests, usually blood and urine tests,
Okay.
to see if your kidneys are functioning properly. They'll check for things like high creatinine levels, which means there's waste building up in your blood, or protein in your urine, which is a sign that something's not right.
What if those tests show something is wrong?
If the tests raise red flags, the doctor might order imaging scans, like an ultrasound or a CT scan.
Okay.
Those give a really detailed picture of your kidneys, show their size and structure, and help identify any abnormalities. Sometimes a biopsy might be necessary.
So that's where they take a small sample of the kidney tissue.
Exactly. It allows them to examine the tissue under a microscope, see exactly what's going on.
Wow. It's fascinating how medical technology can actually peek inside our body.
I know, it's pretty incredible.
We get such precise information. We've covered a lot of ground here. But where do we go from here? What about treatment options?
That's a great question, and that's where we'll pick up in part 2 of this deep dive. We'll explore the 2 main treatments for ESRD, dialysis and kidney transplantation.
Okay, so stay tuned. We'll be right back after a short break to delve into the world of ESRD treatment and shed light on the latest breakthroughs that could change everything for people with this condition. So we've talked about how serious ESRD can be, but now let's get to the part I think everyone's wondering about.
Yeah.
What happens when your kidneys actually fail? What are your options?
Well, the 2 main treatments for ESRD are dialysis and kidney transplantation.
Okay. Those are the big ones, but they sound
Yeah.
kind of scary. Let's start with dialysis.
Okay.
Is it really as intense as it sounds?
Dialysis is definitely a life-sustaining treatment. It basically takes over the job your kidneys can't do anymore, filtering your blood.
So it's like an external cleaning crew for your bloodstream.
Exactly.
But I know there are two main types,
Right.
hemodialysis and peritoneal dialysis.
Uh,
How are they different?
So hemodialysis is the most common type, and it uses a machine to filter your blood outside of your body.
Good.
So you're connected to this machine. And your blood is circulated through a special filter. It's called a dialyzer.
Okay.
And that dialyzer removes all the waste products and extra fluid that your kidneys should be getting rid of.
So you're literally hooked up to a machine. How often does that have to happen?
Usually 3 times a week.
Wow.
And each session takes about 3 to 4 hours.
That's a big commitment.
It is.
Where do those treatments usually take place?
Most of the time, hemodialysis is done at a dialysis center.
Okay.
Although you can do hemodialysis at home now. It's becoming more and more common.
Oh, wow. That's great to be able to do it at home. What about peritoneal dialysis?
Okay.
How does that one work?
Peritoneal dialysis is different. It uses the lining of your abdomen as a natural filter.
Oh, wow.
It's called the peritoneum. And instead of a machine, they use a special solution. It's called dialysate. And they put it into your abdominal cavity through a catheter.
Okay.
And that solution stays in your abdomen for a while, and it draws the waste products and extra fluid from your blood into that peritoneal cavity.
So it's like your body is doing the filtering, but with some help.
Yeah, exactly.
So how often does that exchange have to happen?
It depends. There are 2 main types of peritoneal dialysis.
Okay.
There's CAPD, continuous ambulatory peritoneal dialysis,
Okay.
and APD, automated peritoneal dialysis.
Okay, so CAPD.
With CAPD, you manually do the exchange 4 or 5 times a day, and you can do it at home or anywhere, really.
So that's pretty flexible.
It is.
What about the automated way?
APD uses a machine. It's called a cycler, and it does the exchanges for you overnight while you sleep.
Oh, that's awesome.
Yeah.
So you're hooked up to the machine at night, but then you're free during the day.
Right.
So both types of dialysis have their pluses and minuses.
Yeah.
How do you know which one's right for a particular person?
It really depends. It's a personal decision. You have to talk to your doctor
Yeah.
and consider your lifestyle, your overall health, your preferences. Hemodialysis is usually better at removing waste,
Okay.
but peritoneal dialysis gives you more freedom,
Hmm.
but it might not be right for everyone.
Yeah. It makes sense that it's not one size fits all. But what about that other option? Kidney transplantation.
Yeah.
That seems like the ideal solution.
It is considered the optimal treatment for ESRD a lot of the time.
Mm-hmm.
You know, it offers freedom from dialysis
Yeah.
and lets you live a more normal life. That's complicated.
In what way?
Well, it involves surgery.
Okay.
They replace your damaged kidney with a healthy one from a donor.
Oh, right. So finding a donor, that's got to be the biggest hurdle.
It is a major challenge, and the donor kidneys can come from living donors, like family members or friends,
Okay.
or from deceased donors.
And then you have to make sure they're compatible.
Right.
Is it just a matter of matching blood types?
It's more than just blood type. They have to look at your blood type, your tissue type,
Yeah.
your overall health.
Hmm.
They want to minimize the risk that your body will reject the new kidney.
So it's really complex.
It is.
What happens after a transplant?
Okay.
What's the recovery like? Are there long-term things to worry about?
Well, recovery from a kidney transplant takes a while.
Okay.
It's major surgery.
Okay.
And there are risks, like your body rejecting the kidney.
Right.
And to prevent rejection, you have to take immunosuppressant medications for the rest of your life.
Oh, wow. Yeah, I've heard of those. They basically suppress your immune system.
Yeah.
So it doesn't attack the new kidney.
Exactly. They're really important for a successful transplant,
Okay.
but they can have side effects.
Like what kinds of side effects?
Well, they can make you more likely to get infections and other health problems.
Oh.
So it's a balance, preventing rejection and managing side effects.
So it's kind of a trade-off. You're
Right.
free from dialysis,
Yeah.
but now you have to manage your immune system.
How do you decide if a transplant is right for you? It's a big decision, and it depends on your situation, your health, and how much risk you're willing to take.
Right.
It's definitely something you need to talk to your doctor about.
Yeah.
They can help you decide.
It's amazing that they can even do transplants.
I know, it's incredible.
But it's also really encouraging that there are different options out there for people dealing with ESRD.
Absolutely.
What I'm wondering now is, what does the future hold for people with this condition? Are there any new treatments coming that could really change things?
That's a great question. And that's what we're going to talk about in part 3 of this deep dive. We're going to explore the cutting-edge research and breakthroughs that are changing how we treat ESRD.
Stay tuned. We'll be right back to uncover the future of ESRD care and explore the amazing innovations that could make a huge difference in the lives of people living with this condition.
Oh.
So we've talked about the challenges of ESRD and what it's like to live with this condition. But now let's look ahead. What's on the horizon? What does the future hold for people facing this diagnosis?
There's actually a lot of hope on the horizon.
Oh, that's good.
Yeah, researchers all over the world are working really hard to come up with new treatments and technologies that could completely change how we approach ESRD.
That sounds promising. What are some of the most exciting areas you're seeing?
Well, one of the most groundbreaking areas is artificial kidneys.
Okay.
These aren't just like slightly better dialysis machines. We're talking about devices that you could actually implant in your body,
Wow.
designed to do the same things a real kidney does.
So a real replacement for a failing kidney.
Exactly. It might seem like science fiction, but
It doesn't.
it's closer than you think.
Oh.
Several research groups are making real progress. They're using living cells and cutting-edge filtration tech to create these bio-artificial kidneys.
So someday, dialysis could be a thing of the past.
That's the goal.
Wow, that would be incredible.
Hmm.
What other advancements are you excited about?
Another really exciting area is regenerative medicine. It's all about using your body's own healing abilities to repair or even replace damaged tissues and organs.
So could they actually heal a damaged kidney?
That's what they're working towards. They're researching ways to stimulate the growth of new kidney cells, basically getting the kidneys to repair themselves.
Wow.
And they're also looking into growing entire kidneys in a lab using stem cells.
It's amazing to think we could regenerate organs.
It is pretty incredible.
So these futuristic treatments are still in the works. But what can people do right now to protect their kidneys?
That's a great question. Prevention is key. The most important thing is to manage any health conditions that can put extra stress on your kidneys. So if you have diabetes, manage your blood sugar. If you have high blood pressure, get it under control.
Those are two of the biggest risk factors, right?
Exactly. And don't forget about lifestyle changes. Maintaining a healthy weight, eating a balanced diet, getting regular exercise, and staying hydrated can make a huge difference.
So all those healthy habits we hear about.
Hey, they apply to your kidneys too.
What about diet? Any specific advice for people who want to keep their kidneys healthy?
A lot of doctors recommend a renal diet for people with kidney disease.
Cool.
It basically means limiting certain nutrients that can be hard on your kidneys, like phosphorus, potassium, and sodium. But even if your kidneys are healthy, it's a good idea to watch your salt intake and try to avoid processed foods.
So basically healthy eating for everyone.
Pretty much. The important thing is to be proactive about your kidney health. If you have any concerns, talk to your doctor. They can assess your risks, run some tests, and give you personalized advice. Early detection is so important with kidney disease.
This deep dive has been really eye-opening. We've learned about how complex ESRD is, the challenges of treatment, and all the amazing advances that are changing the future of kidney care.
Yeah, it's a field that's constantly evolving, and there's definitely hope for people facing this diagnosis.
That's good to hear. Remember, knowledge is power. The more you know about ESRD, the better prepared you'll be to make good decisions about your health.
Exactly. Don't be afraid to ask questions, do your research, and advocate for yourself. And remember, you're not alone in this.
That's so important to remember. Thanks for joining us on this deep dive. We hope you learned something new and feel empowered to take control of your kidney health.
Absolutely. And as we look to the future, it's encouraging to see all the dedicated researchers and healthcare professionals working so hard to improve the lives of people living with ESRD.
Thanks for being here. We'll see you next time for another deep dive.